Hello, I'm Smitha Srihari, Director and Head of School at Little Red Hen Preschool and Early Years. As an early years educator, I have come across many parents who are concerned about their children's physical, mental, social, and emotional well being during this pandemic. So, to address these issues of COVID 19 and its impact on children, we have a special guest with us who is a well known pediatrician and a adolescent health specialist, Dr.Sushma Sanjay. She is a chief pediatrician at Taruniya Children's Clinic, Yelahanka, and a visiting faculty at CRPF Hospital, Yelahanka. She has an experience of 17 years in pediatrics and adolescent health counseling.
Thank you, Smitha Srihari, for having me here today for a bonding session with the parent community of Little Red Hen. In the beginning, when you approached me, I was wondering what would one advise such intelligent and responsible parents? Well, thank you, Smitha, for giving me those leading questions, so it has made it easy for me to speak today. Well, SARS coronavirus 2 and the disease it causes, the COVID 19, has been with us for the last 2.5, 3 months, and yet the knowledge about the virus is fairly new and not complete, as it is still an evolving disease and the treatment is not conclusive yet. So here I want to emphasize that it is a viral respiratory infectious disease that is transmitted from person to person via a virus-laden droplet that is generated when an infected person speaks, coughs, or sneezes. So, it is mandatory for us to follow certain rules, as we do not have a conclusive treatment protocol yet. So, all that we are going to be left with is how to prevent ourselves from getting this disease and how to help in reducing the transmission of this virus. So, it has been told several times, you would have read it in the print more often than ever, but I still feel it is very important to mention these points to you, that all we are left with right now is social distancing, using a face cover or a mask, frequent hand washing with soap, water, or an alcohol-based sanitizer, maintaining a good respiratory hygiene, and cough etiquette is going to be mandatory for us for the next couple of months. So now let's move on to our questions. Over to you, Smitha.
Doctor, how do we help our young ones cope with such situations where they have to stay indoors, abundance of screen time, and how do we as a family stay calm through it all?
During a pandemic, it becomes all the more important to maintain routines, as it brings about a sense of order to the day, especially in such uncertain times. You could structure the day probably by having wake-up routine, getting dressed, breakfast time, and some activity in the morning. You could also have your children help you with household chores. It not only gives them a sense of responsibility, but also helps keep them engaged and keeps them physically active. Encourage board games like snake and ladder, ludo. Encourage with jigsaw puzzles, solving puzzles, drawing, painting, any new hobbies that the child wants to develop. It's also a huge opportunity to develop life skills like creative learning, critical learning, decision making, problem solving, and coping with emotions. You could also allot a time in the day where you could join your children for some exercises like yoga, stretching, etc. Or if permitted, for outdoor activities, you could join them for a jog or cycling, skating, although for a limited amount of time. Well, you could end your day with some family time and a bedtime routine of probably reading a story, listening to some music together. Well, maintaining routines becomes extremely important in times like these.
Doctor, we are all expected to cover our faces with masks. How do we go about the new recommendations of face coverings? And how do we help our children to not touch and fidget with these face coverings or masks?
Recent studies have shown that a significant proportion of individuals with the virus lack symptoms. It is more common in the pediatric population. That is, they become potential sources of transmission of the virus even before they develop any symptoms. So, in the light of this new evidence, it was recommended that everyone use a cloth face covering while in public settings where social distancing measures are difficult to maintain. With the knowledge of different masks with different filtering capacities, parents often ask how a cloth face covering could help filter a tiny virus particle. Well, let me clarify that a cloth face covering is not designed to filter the virus particle per se, but it will help prevent inhalation of the droplet carrying the virus. Firstly, it prevents the potential carrier from releasing the infected droplets in the immediate environment. Secondly, those in close proximity, it prevents them from inhaling these infected particles. And thirdly, it reminds one of not frequently touching their face, nose or mouth, thereby reducing the transmission of the virus contamination from the hands or from the fomite contamination. So, what should an ideal face cover be? Just like any other mask, a face cover should also cover the nose, mouth and chin. Ensure there are no gaps on the sides. It should fit snugly but comfortably. It should allow for breathing without discomfort. And any household material could be used for making a mask, but a cotton material is preferred with multiple layers. While in use, teach children and practice with children not to touch the front of their mask, which could be potentially contaminated, not to pull their mask below their nose, and not to let it hanging from the neck. While taking the mask off, care should be taken yet again not to touch the front of the mask. Or parents could also help with removal of the mask, and children should be taught to wash their hands thoroughly after removing the mask. And it is suggested that everyone has at least 2 sets of these face covering, and these face coverings, once after use, should be soaked in hot water with a detergent and should be sun dried for at least 5 hours. If the sunlight is not adequate, one could also use a hot iron in drying these masks. A word of caution on who should not use a cloth face covering. A young child less than 2 years, anyone who has trouble breathing, an unconscious person or a child with special needs who is otherwise unable to take the mask off without assistance.
What are the recommendations of screen time for children, and what is the effect of prolonged screen viewing in children?
Screen time is one of the most debatable and frustrating aspects of parenting in today's world, especially during times like these. With the lockdown and no access to play areas and outdoor activities, and fewer options within our homes, it is but natural for children to opt for the more lucrative ones, and hence the binge watching. It is important to know that prolonged screen hours have a couple of effects on a child. It could disturb the child's sleep cycle, it could cause frequent headaches, blurring of vision for short while, dry eyes and irritation that could be mistaken for allergies or infection. So it is recommended that children are taught to practice and follow the rule of 20, that is, to take a screen time break once in every 20 minutes, to focus on an object that is 20 feet away for 20 seconds, and every additional hour, a 10-minute break, that is to walk away from screen. Also remind them to blink frequently, which helps counter the dryness in the eyes. And there are certain recommendations for screen time which I would want parents to make a note of. A strict no to screen time for an infant below 18 months. 18 months to 5 years, about an hour, which is to watch along and involve. From 6 years to 10 years, it is about an hour to an hour and a half, that could be to involve and to supervise. 11 years and above, it could be about 2 hours. Well, these are the recommendations for recreational screen viewing, and an additional allowance for research purposes and academic purposes could be allowed.
What is the normal recommended sleeping hours in children? And what are the factors that cause disruptive sleeping patterns in children?
Yes, sleep hours could be disrupted. It could be more chaotic or more exaggerated than what one would see during the other holidays. The reasons could be binge watching, long screen hours, or parents having extra household chores pushing their children's sleep time beyond the regular time. Or children could have fears, anxiety, worries, etc., causing them nightmares and difficulty in falling asleep. So it is recommended that the parents set a routine sleep time for their children with a moderate allowance during the weekends. Switching off the screen about an hour before their regular sleeping time will definitely help, along with bedtime routines like reading a story or listening to some soothing music. And at the end of the day, yet again, reassurance that all is going to be fine, along with a good night hug and a kiss, will help yet again. And just to mention the recommended sleep hours, up to 12 months, it is 12 to 14 hours. 1 year to 2 years, it is 11 to 14 hours. 3 years to 5 years, it is 10 to 12 hours. 6 years to 10 years, it is 9 to 12 hours. 13 years to 18 years, it could be 8 to 10 hours. Now, this also includes the daytime napping as well.
Since a lot of us have missed out on our children's vaccinations due to lockdown, how do we reschedule these vaccinations? And what are the safety precautions do we need to take, when taking our children to a health facility?
In our practice, we've seen that a lot of children have missed out on their vaccination in the last 2 months. Hence, rescheduling vaccination and catch-up vaccination becomes very important. As we all know that immunization is a core health service which is prioritized to prevent communicable diseases. Our healthcare system is already overwhelmed with COVID-19, and to increase the burden with an increase in the vaccine preventable diseases spells disaster, especially for a country like ours. So firstly, to clarify that there is no documented risk in immunizing a well child during a COVID-19 pandemic, and those children from homes where COVID-19 is suspected or positive should be immunized only after the quarantine period. The newborn vaccination in the maternal setup is being continued, and it is a safe practice. And the primary series vaccination is prioritized, that is, those vaccines which are taken in the 6th, 10th and 14th week, that is the combination of the DPT, the HIP, the hepatitis B, the injectable polio, the pneumococcal vaccine and the rotavirus. This vaccination should not be postponed. Also, care to be taken that vaccinations like MMR, chickenpox and influenza to be given at the earliest, and vaccinations like pneumococcal and influenza vaccines are prioritized for a certain group of vulnerable children, which you could discuss with your pediatrician. This vaccination of typhoid, though could be skipped, it could also be combined with certain vaccines like influenza and MMR. So don't miss the opportunity when you go in for these vaccinations. The hepatitis A, the HPV vaccine and the boosters which are given at 1.5 and the 5th year could be postponed if there is any logistic issue like travel or transport which still exists. Or you could also finish these vaccinations once the priority vaccinations have been done. Most parents and patients are reluctant and apprehensive to visit a healthcare facility. So would want to inform everyone that most healthcare facilities, the hospitals, nursing homes and the clinics are performing triaging, that is segregation of patients with symptoms of cold, cough and fever from the rest. Hence, no need to panic. Although a few points to be kept in mind, it is preferable that you take an appointment before visit, as it is essential to stagger appointments so as to avoid overcrowding. All parents, caretakers, children except infants to wear masks and face coverings. To maintain social distancing at all times. To make use of the healthcare facility for immunization where permissible. Avoid routine healthcare checkups and well baby consultations at least for some time now. Make a note or record a child's temperature. Make a note of your queries, the child's symptoms, etc. so as to reduce the transit time in the healthcare facility and also to reduce the interaction with the healthcare personnel. And lastly, to inform that digital payment is encouraged so that contamination doesn't take place.